Thank you for joining me today. I'll give it a couple of minutes to see if other people are going to join us. So I'll start at 2:05. everyone. My name is Amy Cardi Metellus, and I want to thank you for joining us today. We hope this day will be beneficial to you and you learn from it. We will start the day with an icebreaker, followed by our panel discussion and presentation. Before we get started, I just want to remind everyone that the views and opinions expressed during the session do not necessarily reflect those of our staff and volunteers. Students and teachers what is best for their community. Pause for a minute to fix the Okay, so before we get started, I just want to remind everyone that the views and opinions expressed during this session do not necessarily reflect those of our staff and volunteers. We support the decision of parents, students,
Before we get started,
and teachers
I just want to
when
remind
determining
everyone
what is best for their
that the views
community.
and opinions expressed during this session do not necessarily reflect those of our staff and volunteers. We support the decision of parents, students, before we get started, during this session do not necessarily reflect those of our staff and volunteers. We support the decision of parents. Staff and volunteers. We support the decision of parents.
Okay, so I think our problem may be fixed now. So let's get started with the icebreaker. The way this is gonna work is that I'm going to make a statement or ask a question and want the audience members to give me an answer. First, first statement. People are using this app and website to communicate during the pandemic. Does anyone know what that website or app is?
Zoom.
Next, let's see. Is that the answer? Correct. Next one. You have to wear this on your face to prevent transmission and infection. Someone in the audience said mask, and is that correct? Let's see. That is correct. Thank you. This was the first country to be free of COVID-19. Someone,
Montenegro.
there you go. Perfect. Let's see the answer. That is correct. If infected with the virus, you are instructed to do this. Anyone?
Self-isolate.
Let's see. That is correct. Quarantine is correct too. And next, how long does it take for symptoms of COVID-19 to show in an infected person?
Five to 6 days.
Let's see, that is correct. Thank you. So now we're gonna move on to the next portion of the event, which is the panel discussion. For the panel discussion, we have Rika, a mother of children who will be going back to school soon, joining us, and Alejandro, an upcoming college freshman. So what we did was that we shared a poll with our audience on social media, and they shared their opinion with us about how they felt about the upcoming school year. And Alejandro and Rika will share their opinions, and we'll see if they share the same opinion as the other people who about how they feel about the upcoming school year and the pandemic. Okay, can everyone please put their self on mute? Thank you. To start off, on our online poll, we asked people if they thought their states were ready for school openings. 76.5% said no, and 23.5% said yes. What do you think schools should do, and why or why not? Why should they open? Why shouldn't they open? Rika, as a parent, how do you feel about the school openings in your state?
In my state, schools open on August 28th. So I think the school should have reopened because kids and everyone have to continue the work, and normal life should have to begin.
Mm-hmm. So you think it's okay for the schools to reopen, and like your states can have the proper proper tools needed to protect everyone and keep everyone safe? Now taking precautions? Rika?
Sorry?
Oh, I said, so do you feel that your state has everything it needs to keep the students and the teachers safe, and that they're doing everything okay? There's nothing they can do to make things better?
Even though schools are taking proper safety, we can't predict the situation. So they gave the option like in person and virtual class. So we choose virtual class. So we are okay with the virtual class.
Okay. Alejandro, what about you? Do you feel that your state is ready to open schools again, and why or why not?
My school's in Texas, so I don't think we're currently ready to resume face-to-face learning
Okay.
because we are having a increase in cases currently.
Okay.
But I think that virtual learning is the way to go.
Okay. So next we asked people how schools should operate. 11.8% stated that they would like to see classroom learning resume with limited hours. 47.1% said they would like to continue with online learning, and 35.3% said they would like a hybrid curriculum where they attend virtual classes and in-person classes. So in Rika, in your opinion, how do you think your school district should have operated? Should it have gone completely online, or do you agree with the hybrid model, or do you agree with kids going completely back to school?
I agree with virtual class.
And why do you think that would be safer, the virtual class?
The main thing, they can avoid the spread of COVID.
Mhm. Okay. And Alejandro, what about you? How do you feel about the how schools should be operating? Do you think they should be online, hybrid, or should they be in person?
My university decided to go totally online,
Mhm.
and I thought that was a really good call.
Okay.
I just don't think that we're ready to have that many people gathered together all at one time.
Okay. Thank you. When asked if they thought schools have the ability to keep their students safe, 76 point student and staff safe, sorry, 76.5% of people responded no, and 23.5% said yes. Do you think that schools are taking the right steps? And if no, where do you think they can make improvement or changes? Rika, you can go first.
Yeah, the schools might be taking the proper precaution, but as I said already, we can't predict the situation. So I feel they should have been more focused on virtual class.
Okay. Alejandro, how do you feel about this?
Yeah, I agree as well. I mean, even if we do resume to face-to-face learning and we try to take precautions, we would still be taking a risk. So I think that virtual learning would be the proper course of action.
Okay. 100% of teachers, 100% of parents said that they were satisfied with current online curriculums and courses that were offered to students virtually. Rika, as a parent, were you satisfied with the curriculum that was being provided to your children during the pandemic, like when it first started?
Yes,
Or
of course.
sorry, go ahead.
Yes.
Yes, okay. What about you, Alejandro? I know you are going to college soon, but I know that the pandemic started during your last year of high school. So were you satisfied with the curriculum that was being offered during your last couple of months in high school? And were you able to get into the environment very easily and adjust?
Yeah, it definitely took a couple of weeks to adjust, but once everybody got on board, it went pretty smoothly. And I did feel like I was learning a lot.
Okay. What are your biggest fears for the upcoming school year? Rika, you tell me, as a parent with young kids, what's your biggest fear?
Yeah. Of course, the kids are losing the in-person human interaction, sports, gatherings, schools event, exams, real-time experience, and of course, they're missing their friends. I'm fear that the virtual class should not go long. The pandemic should have end soon. So, if there is a in-person class, then the kids might be exposed to the COVID. If kids infected in school, then they because they're transmissible. So even the elders at the house, they get infected, and even the older or infant, or even any health complicated people, or pregnant ladies, that could lead to the fatal.
Okay. What safety precautions are you taking to protect yourself? Alejandro, you can answer this question first.
I try to go out as little as possible. I try to only go out to get groceries and other necessities. And even when I do go out, I tend to avoid crowds and I wear a mask and carry hand sanitizer with me at all times.
Enrica, how are you protecting yourself and your family?
Yeah, we are staying at home, not going anywhere, and we're doing the online shopping. If must, like, if in case of any emergency, we have to shop. Means we have the mask, of course, using the hand sanitizer and maintain a social distance and so on.
Well, that is all questions we have for you. I want to thank you both for joining us today and sharing your opinion with us.
Thank you.
The next part of the event is the actual presentation on COVID-19 and school openings. We will be discussing the reopening of schools and steps you can take to protect your communities, children, and children from the coronavirus pandemic. Next slide, please. To start, we would like to educate you on the symptoms of COVID-19, aka coronavirus. The disease spreads from person to person, and you have to know the symptoms so you can protect yourself. Some of the symptoms include coughing, shortness of breath, fever or chills, fatigue, loss of taste or smell, sore throat, congestion, runny nose, pressure in the chest, and nausea or vomiting. So if you have any of those symptoms, we suggest that you get help as soon as possible, or you self-isolate yourself until you can recover to keep safe. And please remember that COVID-19 affects people of all backgrounds and ages, but some groups are more vulnerable than others. As you can see on the screen, we have different age groups listed with different numbers when it comes to the total number of deaths. What this is showing is that the older the individuals get, the more likely they are to die from coronavirus. And that is because they are older and the immune system is not as strong as the younger children who can fight it more easily. So you're probably wondering why we're showing you this. The reason we are showing you this is to show you that even though children are less likely to die from it, they can still catch it and spread it to other people. And if we have kids going back to school in large crowds and they're gathering in large crowds, then they can catch the infection and easily spread it to adults in their household and in their communities. A recent study from South Korea showed that children 10 to 19 were spreading the virus just as fast as adults and had the highest rate of COVID-19 amongst household contacts. And as stated before, once a child is infected, they can easily spread the virus to the adults in their household. So it is important that you take some precautionary measures. Knowing the dangers that they have to face with school opening, many teachers and parents are against going back to school so fast. For example, teachers in the Elizabeth School District do not want to go back to school. As a matter of fact, 375 teachers have refused to go back to work because of fear of the coronavirus, because of the fear of the coronavirus pandemic. And the school district is reporting that they may not be able to open because so many teachers don't want to go back to school. A lot of parents are also agreeing to continue online learning. For example, Dr. Sanjay Gupta, the CNN chief medical correspondent, has decided to keep his 3 daughters safe by continuing with virtual learning. So this is, now we're going to show you a video of teachers and students, of parents expressing their opinion on the upcoming school year and the coronavirus pandemic.
When the mass quarantine took place, around 1.5 billion students were restricted from going to school and had to adapt to the new distance learning system. Now, as schools are reopening again, many students, parents, teachers, and medical professionals are voicing their opinions on this pressing topic. Opinions are scattered based on the location of the school, age of the child, and various prevention measures enforced in schools. Those who believe that students should return to school claim that young students are at a low risk of contracting and spreading the virus, and that the lack of in-person school is wholly detrimental to students. Those who believe that students should not be sent back to school claim that students and family will be at a severe health risk. Teachers have been some of the greatest advocates for their beliefs as they're in the epicenter of this debate. Here's what some of them are saying. Noam Kasofsky from Nashville, Tennessee states, if return to school creates a new wave of infections, children in poorer neighborhoods will be disproportionately impacted. There is no ideal choice, but it is hard to argue that a flawed education is a worse outcome than losing a family member or even their own life. Of a series of bad options, online schooling is the best one. Medical professionals and parents also have strong opinions on this topic. Here is how Dr. Mary Beth Mioto responds when asked whether she will send her child back to school. After carefully examining the systems to control and respond rapidly to change, yes, I'm sending him because it's a growth-appropriate step and important socially, emotionally. Whether in support or against of having students return back to school, many individuals have agreed on the preventative measures that can be established in schools. Many schools are utilizing a staggered system where students go at different times to limit the amount of students in school at once. In some countries, officials check the students' temperature before they enter the school. In the classroom, desks should be spaced 3 to 6 feet apart, and students should be mandated to wear masks. Students should not be allowed to use water fountains, eat in cafeterias, or use the bathroom without following a specific procedure. Schools also should provide hand sanitizer, cleaning supplies between classes, and constant monitoring of halls, bathrooms, classrooms, and school entrances. Students should be taught these health guidelines. Thank you for watching and stay safe.
Okay. So, as you can see, there are precautions that many people can take to keep themselves safe. And I just want to remind you guys of some of the things that can be done in schools to protect children from this virus and this pandemic. First thing that can be done is that desks and classrooms can be spaced 6 feet apart so that the kids are not too close to one another. 2, the schools can place hand sanitizing stations around campus so that children can easily access them and clean their hands when after touching shared items or shared equipment in the classroom. And they can enforce the alternate stall policy, which states that students are not able to use the bathroom stalls that are next to each other. And they can allow teachers up to 7 minutes to properly sensitize and wipe down desk and other surfaces in between class periods. So do not let the students just rush into the next classroom right after they're finished with the previous class. You have to give the teachers some time to like clean off the surface of the desks in their classrooms and prepare for the next group of students that are coming in. Comply with rules used to regulate student traffic when within hallways and small spaces. So when in a hallway, make sure that kids are staying 6 feet apart and there aren't too many students or teachers in one specific area at the same time to lower the number of transmission or to prevent transmission period. Okay, next. So I know that many people are deciding to continue with virtual learning, and this has actually been proven difficult for some students, parents, and teachers. So we want to share some tips with you to aid in improving your experience with virtual learning. To start, for the teachers, please familiarize yourself with online platforms such as Microsoft Teams and Zoom. In addition, make sure you learn how to utilize technology to your advantage. For example, learn to use online proctoring services that will catch students that cheat. Parents, You have to learn how to use your child's online software so that you can help them if they need any help. And remember that the teachers are under a lot of pressure. So if an issue arises, try to offer your empathy and be kind when addressing them. And for the students, make sure you get used to whatever platform they're using for virtual learning. And remember to offer your teacher help if they need help with the technology that they're currently using. And do not use softwares to cheat or share answers. In the end, it will only create problems for the administration and teachers. So I hope you guys will consider this advice and keep safe.
Virtual learning is a major problem for many students in impoverished areas that do not have access to the technology required for virtual learning. Students in this situation should reach out to their school or county to ask them for the devices they will need for virtual learning. Those who are unable to obtain what they need from these institutions should reach out to local or national organizations that provide funding for students without access to technology. Furthermore, if your school cannot provide you with adequate learning resources, go online and find a trusted educational website. Websites like Khan Academy and Quizlet offer hundreds of thousands of practice quizzes and assignments that can help you. In fact, Khan Academy even caters to the curriculum of your classes or assessments. You can choose to study for assessments like the SAT, or you can choose to study for classes. They offer curriculum-based quizzes for both regular and advanced placement classes. That being said, make sure you protect yourself both in the classroom and outside. When outside, make sure to, number 1, distance yourself at least 6 feet apart from everyone else. Number 2, wear a mask whenever you go out, and make sure it covers both your nose and your mouth. Try not to touch surfaces or items unnecessarily. Number 3, use hand sanitizer immediately after you exit a building where you might have been exposed to germs and bacteria. Number 4, try not to speak unnecessarily to make sure that your dust and saliva particles are not being sent out of your mask. As we mentioned before, your mask must cover both your mouth and your nose. Make sure that you don't pull your mask down to your neck, as the germs on your neck will be exposed to the fabric of your mask, which will then return back up to your nose and mouth. We will now be playing a video that features the opinions of 4 professionals on this topic.
Is it safe to reopen schools in the fall?
Yeah, I mean, everyone is right here. It's so context dependent. We have very different outbreaks happening across this country. Places like Florida and Texas, you couldn't open schools safely because of the level of community transmission. In certain states where there is low infection rate, yes, you can, but you could do so safely with mask wearing and social distancing where you can keep things under control. But yes, so it's going to be highly dependent on what we're seeing across the community.
And asking these 10-year-olds to sit at their desk all day on a computer, wearing a mask, 3 feet apart from their peers, no group work, no one-on-ones, just they can't stick their arms out, you can't touch. I just don't see how this is, I don't see how this is better.
And I do want to ask you about K through 12. As you know, the Secretary of Education this week said all children should be back in school this fall. There's even a potential risk of losing federal funds. Then just this afternoon, the governor of California said most California schools are not going to be back in person. What are individuals, what are parents to make of this?
You know, obviously, this is a disconcerting problem because we care so much about our children and their education. The way I look at it, Judy, quickly, I have, looking at 40,000 feet, a default position. The default position is that you should try to the best of your ability, with all considerations to the safety and welfare of the children and the teachers, we should try to get the children back to school as best as we possibly can. With that as the framework, you've got to look throughout the country that the level of infection is different from region to region, state to state, county to county. So there are going to be some counties where there's no problem. Take the kids back to school, they're not in danger. In those areas where it's iffy, where you see that there's a degree of infection, then what some schools will do, short of just shutting down, and some authorities may decide to do that, is to do something with a little bit of creativity, maybe alternating classes, spacing of the desks for children who can do it, wearing masks, protecting the vulnerable. So you can go from one extreme to the other. You've got to say, I'm going to try to open the schools to the best of my ability, and if there are issues with activity of virus, try to mitigate it by some creative capabilities. And I think that's what you're seeing as different states respond to the mandate to open schools.
So I have 3 girls going into 10th grade, 8th grade, and 6th grade. So as you might imagine, what's going to happen this fall is topic number 1 in our household. What's going to happen with schools? The American Academy of Pediatrics, they've been very clear on this. They say kids physically in school is key to their development. But we also know that case numbers continue to rise across the country. Still not entirely clear just how transmissible, especially young kids are. We know they're less likely to get sick, but how likely are they to contribute to the spread? We also know for sure that schools are going to have to do everything they can to try and keep kids safe. So it's going to look a lot different when you get to school this year. Now, if there's anything we know about this virus, it's that it doesn't like masks, so those are going to be required in all schools, and it doesn't like distance. So you see here, the desks and the teachers area all 6 feet apart. Well aware that a lot of school districts can't possibly do this. All the desks facing in the same direction. If there's any virus in the area, you want it going in one direction as opposed to mixing. Also, there's this idea of cohorting. That means that the same students would be together all day long. Less spread, less mixing that way. And also, if somebody does get sick, it's easier to contact trace. Another thing schools are going to have to think about, trying to reduce areas where children will congregate. Think about staggered start times, for example, rotating classrooms, one-way hallways, and possibly even getting rid of common locker areas. And another thing schools might start doing is having outdoor classrooms, or at least opening the windows to improve the ventilation in indoor classrooms. At the end of the day, every family is going to have to look at the risks and the rewards of sending their kids back to school. Also, pay attention to what's happening in your community. Is the virus increasing or is it decreasing? That may play a factor in your decision. And finally, use the rest of the summer to get your kids used to wearing masks, which they're going to have to do, and of course, washing their hands as much as possible.
As highlighted in the video, most professionals believe that location is the most important factor in whether or not to send children back to school, and students must follow all health guidelines to prevent the spread of the virus in schools. Whether you're going back to school or participating in virtual learning, please practice proper safety measures. We as a community cannot slow down the spread of this virus without proper physical distancing and safety measures. Try to limit your exposure to those that are not living with you to reduce the risk of contracting COVID-19. Check out some of our articles on our website for more information. You can find informational posts on our Instagram at FutureExecs also. Thank you for joining us today, and be sure to stay safe. We hope this presentation was beneficial to you and you learned something new. The views and opinions expressed during this session do not necessarily reflect those of our staff and volunteers. We support the decisions of parents, students, and teachers when determining what is best for their communities.
Okay, everyone, now it's time for the Q&A. Does anyone have any questions they would like us to answer? No one else at all has any questions? Okay, everyone. It was a pleasure joining you guys today. Thank you for attending our event, and we hope you'll be able to attend future events. Okay, guys, we're off the recording now. I hope everyone has a good day.